Hi everyone, my name is Dr. Bisma and I'm here with Dr. Ducu and we're both from Dr. Ducu Clinics. Today, what we're going to be talking about, Dr. Ducu?
What we're going to talk about today is what makes us different from non-surgical BBLs, liquid BBLs, and everything else, every other, what do you call these things? Names?
Aesthetic procedures. So I think the alternative names, you mentioned some liquid BBL, non-surgical BBL, dermal filler BBL or temporary BBL. Those kind of other names that people are wondering and trying to figure out. So we have one called the DBL, and I think all 10 of our lovely subscribers would like to know what's the difference between the DBL and the traditional non-surgical BBL or liquid BBL.
Okay, so we have trademarked our DBL for several reasons, and you say 10 subscribers, but I bet you that after this we're gonna have at least 11.
Yay.
So
by the way, which camera are we looking into?
I'm not looking at any cameras, I'm literally looking at Caro. It makes it easier for me, or actually if I look at you I feel better.
Yeah, okay.
All right, anyway, so just to give a short version explanation. It's all about the technique. Mm-hmm. The way you do a procedure, what it does is it gives you a certain safety profile. Let's think about lipofilling, which are lipo BBLs, which is basically a surgery that takes fat out of all the body and injects it into the bum. About 7-8 years ago, most of the surgeries were done with injecting the fat into the muscle and through the gluteus maximus into a danger area. And that created a lot of complications, the main one being embolism, pulmonary or cardiac embolism, which in quite a few cases led to the tragic death of several people. Now, what happened is, plastic surgeons all around the world started looking independently at how to make this procedure safer, and they came to the realization that injecting the fat on top of the muscle and under an ultrasound gives a lower risk of having an embolism. So they've improved the technique. What have we done? We've done something similar. We've created a technique that so far, since 2018 until now, has given us 0 infection rate, and we're talking about over 5,000 cases with 0 infection rate. We're talking about patients not done only by me and Dr. Bisma, by other doctors that have been working in our clinic as well. So the protocol itself is very important because it puts the safety of the patient first. Now, there have been people that have been questioning if it's surgical or non-surgical. And there are guidelines right now that are not very clear. But what we can tell you is this: be it surgical or non-surgical, the DBL is done with injections, with a cannula that is blunt, under local anesthetic. No general anesthetic is required, no sedation is required, there is no downtime. You walk off immediately after. The second difference between the DBL and liquid BBL or whatever else is that it's done by doctors that are fully qualified, that are trained in this. We know the anatomy, we know the risks, we know how to deal with the complications. We have patients, modesty aside, flying from all over the world. We have patients flying from Peru, from Chile, from Brazil, from Dubai, from Australia, from New Zealand, from China, from the US, everywhere in the US.
We're international, guys.
We're international, and we're not talking about patients coming to get the procedure done. We're having patients coming to sort out their complications. So we sort out complications. Our protocol and our technique, besides the fact that it delivers good quality results, has a very important factor. It has a very, 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 very strong safety profile. We have, if I'm not mistaken, in total 12 patients that had complications, and those were delayed hypersensitivity reaction complications. What does that mean? They reacted to the hyaluronic acid itself, which was biphasic hyaluronic acid. What did we learn from that? That we only use monophasic. Biphasic hyaluronic acid sadly can cause autoimmune reactions in some patients. So we've continuously improved our technique. Second, I think we are one of the first clinics that have used hyaluronic acid in the body along with ultrasound. We started using ultrasound and hyaluronic acid injections in 2020. As far as I am aware, and correct me, Dr. Bisma, if you know something different, we are one of the first, if not the first, in the UK or maybe even in Europe that use an ultrasound to give extra safety to the procedure. We follow the whole protocol. What people don't understand is it's not only about injecting and getting the result. It's making sure everything is done in a very safe and very clean aseptic environment. It's done with single-use sterile, what do you call them?
Yeah, single-use sterile products.
Exactly. Yeah. Thank you. English is not my first language. You have to understand that. It's not that I speak Romanian better, because I don't, but does help. My excuse does help. Now, besides that, local anesthetic is a big issue. Local anesthetic can have side effects. Local anesthetic is usually a prescription-based medicine. You can have toxicity to local anesthetic, so you need to be a doctor. You need to be aware of how much you can use safely, and even when you use the safe amount, if you're unlucky, you can still get toxicity. You need to know how to treat it. This is a procedure that, from my point of view, should only be done by medical personnel, and the most important factor is any complication we can deal with. A doctor can deal with a complication, whereas even if you do it with somebody who is medical but is not a doctor, they won't be able to deal with the complications. So they need to be in contact with a doctor that can deal with their complications. But doing it with medically trained people makes it safer. Doing it with our technique and with our protocol, from my point of view, again, everybody thinks their technique is the best. I cannot contest that. All I can say is, soon me and Dr. Bisma, we will publish the results from the last 4 years. We do not get complications. Our worst complications are the hyaluronic acid going away faster than expected, which is something that maybe patients sometimes don't feel happy about, but us as doctors, we have to put their safety first, and we are happy about that. It's very easy to replace the hyaluronic acid if it goes faster than you expect. It's very difficult to deal with an abscess. It's very difficult to deal with skin necrosis. If you get sepsis, if you end up in a hospital, or even worse, that is really, really bad. We managed to avoid that, and we also know how to detect the signs very soon and very fast, so we avoid those type of complications. But to go back, what our technique does different than everything else and every other technique on the market is that it is very, very safe. To have a complication rate less than 1 in 5,000, that is something that very few procedures have, and especially a procedure that is done in the gluteal area where the vascularization is not that great. It's not the cleanest area of the body. It means that the protocol that we have and that we have trademark works, because it's not only me, it's not only Dr. Bisma. Every doctor that has worked with us has managed to keep that safety profile, has managed to keep patients and avoid infections, has managed to avoid trauma, has managed to avoid nerve damage, has managed to avoid compartmental syndrome and other even more serious complications like embolism. Again, we are one of the first, if not the first, clinic in the UK that have incorporated ultrasound into our technique. Anything to add?
I think you touched upon something very interesting, which, you know, sometimes patients might say that, you know, like if there's a risk of the filler disappearing, then, you know, what's the point of me doing this procedure? Although that risk is very small, I think, you know, as well from seeing some of our clients that had lipo BBLs, how their results were. I think I found that quite a few patients, I mean, people assume that the lipo transfer, so the fat transfer BBLs are more permanent, shall we say, but results heavily vary as well, I think, as well. And I don't know if that's based on who's doing it or the patient's own genetics. I'm sure there's multiple factors, aren't there?
So 100% there's multiple factors, but the main factor is actually patient's genetic and metabolism. So the same as with hyaluronic acid is the same as with fat transfer. Fat transfer will stay on somebody like me who's been chubby all their life. If
Does he look chubby to you guys?
If somebody is has a fast metabolism, does workout, is skinny, even if they put the weight on and they do what we call a skinny BBL, they will notice that within 2 years maximum, most of the fat will go away. So sadly, there is nothing that gives permanent results, not even fat transfer. After a few years, the fat will go away. You will have sagginess in most patients. And it's the same with hyaluronic acid. The only procedures that are permanent are the ones that we actually want to avoid. Permanent fillers cause damage over time. Anything that's permanent will cause autoimmune reactions in time, will cause encapsulation, will cause migration. Both you and me have seen hydrogel, which is sadly still CE approved, and it's also approved in the UK under different brands to be used. And we've seen a lot of patients that don't have complications in the first 3-4 years, and then they have really bad complications. It doesn't happen to everybody, but when it happens, it's so difficult to take care of, and it either requires extensive surgery or minor surgery with liposuction, several sessions. It can take months or years to get rid of that complication. Same with biphasic fillers. If you are unlucky enough to get an autoimmune reaction, which again is very, very rare, that autoimmune reaction creates encapsulation, so you cannot melt the biphasic hyaluronic acid. So again, it can take years until you get rid of all the hyaluronic acid. So an advice that we give to our patients is this: you don't want something permanent, it's better to do it. This is not a life-saving procedure, this is not something that you need, this is something that can give you a boost in confidence. This is something that we've developed it actually to target patients that had lipo BBLs or trauma and give them an alternative of repairing their asymmetry, their loss of volume, their atrophy, be it congenital, be it based on trauma or lipo BBL, without having to go through extensive surgery that usually is not successful, because again, any type of fat transfer requires blood supply to survive, and usually when you have trauma and atrophy, you have fibrotic tissue, which is scar tissue on the inside, so you won't get the blood supply that you need. And at the same time, implants are, when we talk about implants, we're talking about a very big surgery with high risk of complications, not a high risk of death, but a high risk of complications, and can be uncomfortable. So it's not for everybody. Plus the recovery time is very long. So some people will choose implants as a way of sorting out asymmetry or trauma. But again, that requires a lot of downtime and extensive surgery. So we have developed this method to help people regain their self-confidence, get rid of trauma, asymmetry, atrophy, be it congenital or be it post surgery, post complications, post any other type of trauma, and it works. You can look at our results on our official Instagram, which is at Dr. Ducu, where I have to mention a lot of people feel that those are all my results. They're not. Half of them are my doctor's results. And those results show how we can help people. It's not only about making big bumps. You see there people with atrophy, with big asymmetry, post-surgery, or complications even post hyaluronic acid injections done in a different way with a different technique. That, again, this is my personal opinion, but when you inject superficially, like you inject on the face, you don't have the same vascularization that you have on the face, so you don't have the same protection. People tend to underestimate what an infection can do in the gluteal area. You have a lot of fat. Vascularization is not great. It's a great area for bacteria to thrive, and you can get skin necrosis, fat necrosis. We've seen some cases that are really, really, really bad and make us very sad. And at the same time, we are happy to be able to give those patients their self-confidence and quality of life back without them having to go through extensive surgery. I cannot stress enough how important that is for our patients. And again, having a safe procedure with such a good safety profile is something that I think is good, and going forward is what I think the future will be like. I think the future is concentrating more and more on improved safety and reducing the amount of surgery people get. Now, at the same time, this procedure has a lot of bad press, but what you have to understand is that it has a lot of bad press because people who are not trained to do it, who don't know anatomy, who don't have medical background, are legally allowed to do it. As long as that will be the case, patients sadly will choose to go and pay less, and they won't think it will happen to them until it does. They don't realize the risk they expose themselves to. Because even us in general, I think in life, we always think it cannot happen to us. Our brain is wired, even when we see a tragedy, our brain is wired in such a way that we sort of are in denial. We don't think it can happen to us. We feel sorry, we feel bad, we empathize with other people who go through tragedies, but we never consider that it can happen to us. And there are things that we cannot avoid, but there are things that we can avoid. And I think patient education is the most important, because there are countries where there are regulations and you still have non-medics performing procedures in hotel rooms. So even with regulation, this problem is not going to go away. The only way it's going to go away or be limited is by doing patient education. And with this channel and with this talk, I think that's our main aim here. It's directed to you guys, to our patients, all 11 of you.
We've got one extra one now, at least. Hopefully another 2.
Let's hope another 2.
Yeah.
Yeah, 13 can be lucky. So guys, by the end of the 2025, we want 100,000 subscribers. This is our first talk.
Like, follow, and subscribe.
Please. And share this video. It helps, it's educational. We're gonna start posting experiences of our patients that went through sepsis, infections, or even worse, because they made the mistake of going to somebody who wasn't trained and could not handle complications, could not detect complications. Let's not think about banning a procedure that can be very safe, as some people do. Let's think about educating our patients to go to people that can deal with complications in a safe and fast way.
And I think I really like the point which I wanted to highlight again, which you mentioned, is that we, especially yourself, Dr. Ducu, has many years of experience with doing this procedure. So it's not just the procedure was created, it was perfected over the years. So along the way, you know, as much as we knew about dermal fillers and aesthetics before, every year we're learning more and more, like the research is expanding. And as the research expands, as we learn more, as we see more, we change our protocol accordingly. And that's why we've come to find, you know, like we used to use biphasic fillers for a short while and then we stopped using them. We're now using much safer fillers in comparison. The technique is still very similar to how you created it at the beginning, but we've continued using that because we didn't see any issues with that. Infection rates were very low, and so we continue to utilize the things that were safe and will continue to be safe, and things that we see are maybe not working so well, we change, we adapt, we make them safer. And I think that's a really important thing to take away as well, is that many years of experience specializing in this kind of procedure really makes a difference. So then when it comes to patients that have undergone or had any issues elsewhere, I feel like they feel more confident to come to us. We know what we're looking at when we see it, and we know what we can do to kind of tackle that when they do come in to see us. And it's really good. It gives a lot of people hope. I saw a couple of people come in that had lost hope. They didn't know what to do. They didn't know where they could go. And they were fortunate enough to be able to come across and find us. And they were so grateful that, you know, we were able to make their lives better.
Yeah, and this is one of the things, one of the reasons we chose to become doctors. It's, I think, one of the biggest satisfaction is when we help our patients, and we've had quite a few patients that had tears in their eyes, and it can be very, very emotional and satisfying at the same time. And as Dr. Bisma was saying, because the complications that appear with this, with injecting hyaluronic acid in the buttocks, these are complications that are new. What you will find is that over 95% of those complications are caused by non-medics, which should tell something, which is actually normal, because if we have to study 11 years to do our job.
A lot of in-depth studying. So
and there is a reason for that. There is a reason for that. So don't get me wrong, there are people like painters, artists, sculptors that might be able to give amazing results because they have this talent. But this and then are medical procedures. These are procedures that have to have good results, yes, but most importantly, they have to be safe. They are not life-saving procedures. We shouldn't be taking risks.
But, let's wrap up for today. I think we've got lots to talk about, so which is good.
So, thank you.
All right then. See you on the next episode.